faculty at Sri Sathya Institute of Higher Medical Sciences, Prashanti Gram.
Om Shri Sairam. I offer my most humble pranams at the divine lotus feet of my most dear Swami. I thank the organizers for giving me this opportunity, and I hope I do justice after such a dynamic speaker, Dr. Prayag sir. But he's made my job a little easy because he's already given you examples of the wonderful studies that has been done in our Swami's hospital using this term, which is called the precision medicine, that is taking personalized medicine to the heart. So we all know variety is a spice of life. Each one of us is completely different. But and as William Osler has put, if we do not understand the variety amongst us and treat patients, then we would just be using it as science and not as an art. So what exactly do we mean by precision medicine? So it refers to the customization of healthcare, that is using the diagnosis, treatment, and prevention strategies, but beyond what people have already understood as only the genetic makeup, like what Rita ma'am also said, we have to include the other factors that affect a patient's health, which includes its lifestyle, its environment, and clinical data. So it is not the one size fits all model, but it is the precision medicine. For example, the precision medicine topic has been extensively covered by the oncology people, where each of the receptors that contribute to the disease, the cancer, has been studied, and very particular specific target therapies uh, have been developed. So we all know the precision medicine is widely developed in the oncology field. How can we do that in cardiology? So imagine you're going to your favorite shopping mall. Are you going to choose the shirts that are available on the stalls, on the racks? Are you going to get a personalized fashion designer to choose the color, the size that perfectly fits you? So that's just in short what precision medicine is all about. So the medicine of the present is to see that one treatment and see how it affects a particular patient, whether there is any response or not, or if there is any adverse effect or not. But with the available data, the different genomics and all the omics in our medicine, we're able to find out what is that particular therapy that will suit that particular patient, having seen all the factors that affect him. So the different omics in precision medicine, I have to be a little quick because we're running short of time. So the metabolomics is the assessment of the small molecules, the metabolites in the biological samples, from which we can determine what is the makeup of that particular person. The transcriptomics, like ma'am had said, the miRNAs. The genomics is the interaction of all the genes in the human genome. And the proteomics is what all the proteins that we are made of. And of course, the artificial intelligence that Sir had elaborately told about the machine learning and the deep learning, cognitive computing. But it's not just with the omics, the technology has also affected the therapeutic interventions these days. So we have specific genome editing, therapies for particular genetic diseases, stem cell therapy, the robotics. So all of this, the technology has also added on to the precision medicine. And the data collection for developing these are coming from the wearables and sensors and the implantable biosensors. So, for example, this is a wheel of fortune that we read for the cardiomyopathy. So what I meant was the genetic background of the individual has to be combined along with the environmental factors, like his lifestyle, the acquired factors, and the various comorbidities that already affect the patient. And then we come about with a phenotype. For example, this cardiomyopathy phenotype, the outer circle is just about say, the LV wall thickness or the LV ejection fraction. So those are only the outer phenotype. But the genotype of the patient will involve the rare variants. The RV stands for the rare variants, the common variants, then the comorbidities, the lifestyle, and the ethnics. So all of this will all contribute to how we have to target that particular the treatment for that particular patient. So the precision medicine system Sir has elaborately done as to how we have to develop data for each culturally different people, like our Indians and Asians, different from the Western data that is widely available right now. has to do with, a lot of studies that will recruit such cohorts of patients, do specific data collection, data description, the curation, analysis, and the reporting with the help of AI and ML, and then validate these findings so that we get more precise information so that we can not only diagnose and also treat and follow up such patients for better safety and outcomes. So these, I'll be very quick. So for examples of how it has been used in cardiology so far, for example, the genetic variants linked to the various diseases like familial hypercholesterolemia, the very specific hypertrophic cardiomyopathies, and to find out if we can have some biomarkers to stratify the risk and guide therapy decisions, and to tailor the drug therapy based on their genetic makeup. For example, we all know this clopidogrel resistance, which is very, very obvious and important for the Asians, and reducing the adverse drug reactions if we know if some particular group of individuals will be affected by certain doses of medicines, and data-driven risk prediction, what we have done in our hospitals as well, and targeted therapies like the PCSK9 inhibitors and the latest for the amyloidosis. So I'll just briefly tell about certain examples that we have for each of the subsection of cardiovascular diseases. So with cardiomyopathies, whether it is restrictive or hypertrophic or the arrhythmogenic variants of cardiomyopathies, based on the genotype and the other lifestyle comorbidities and genetic variant data, and the phenotype which we can get from the imaging and other non-invasive techniques, we will have to risk stratify and with all the studies have precision management in terms of the gene-based therapies, the modifiable factors, and also the targeted use of the rehabilitation measures. The next would be, for example, this is one particular study that had shown that in hypertrophic cardiomyopathy phenotypes, 30 to 40% of them are obese. So will they have a different set of the phenotype compared to those who are lean with HCM? So this is just an example I'm giving you so that this is how the precision medicine is evolving and trying to target specific therapies for patients. So the transthyretin cardiac amyloidosis is a very famous example amongst all students as well as to how precision medicine is evolving in cardiology. So we have the molecular level elucidation of the disease mechanism and the advances in non-invasive that we can detect the cardiac amyloidosis even without a histological confirmation of the diagnosis with just the different non-invasive techniques we already have. And then and to detect the prevalence of cardiac amyloidosis in other diseases which were not thought to be associated. For example, aortic stenosis with cardiac amyloidosis is such an emerging topic these days, and treatment of both has to be simultaneous to have better outcomes for that particular patient. And the newer therapies that we have in terms of the gene suppressors, like the gene silencers, we have the patisiran, the stabilizers, which are commonly used these days, tafamidis and diflunisal, and the removers, which are underway. So there are a lot of pending questions related to this, which we will be probably able to answer with the help of precision medicine and the studies that are going on. Towards precision medicine and heart failure, which I've already told about amyloidosis, we also have about hypertrophic cardiomyopathy, the different drugs treatments we have, mavacamten, and for example, the glycogen storage disorders in children where we can treat them with specific gene therapies and the aglycidase beta, the molecule. The same thing I will have to rush through now. So the non-invasive imaging has really contributed to precision medicine in terms of the diagnostic strategies. Identified with, we have the PET, we have even diagnostic for a coronary artery disease, IVUS and IVUS nurse, which is near infrared spectroscopy. All of it has contributed to help us make decisions as to what would be the best treatment for that particular patient. And the other vascular diseases where we have the connective tissue disorders like the Marfan syndrome, Loeys-Dietz syndrome, where we can do specific treatments for these familial and the genetic disorders. And we have the arrhythmias, which are extensively studied because most of them are very gene specific disorders, especially the long QT syndrome, the Brugada syndrome. So the current and the future, the areas of the precision medicine would be in the genetic testing and finding of the autoantibody titers, and then specific gene therapies, and to avoid help in the risk stratification to avoid sudden cardiac death. So I would just conclude with saying that the benefits of the precision in practice would be to improve the safety through reducing the adverse effects and drug interactions, to enhance the outcomes so that we select the right treatment for the right patient at the right time. And also, it will be cost effective in the long term. But we do have a lot of challenges in both here as well as in the West, where it will be high cost and is limited access to genetic testing. There is need for clinical education and infrastructure for data interpretation, and there will be eventually ethical and privacy concerns related to genetic data. So I would just conclude by thanking all of you for this opportunity, and let us all in this path. We are just probably in the, like ma'am said, 20 years back we have started. We are probably slow, but we are always steady. We would be fast progressing, and maybe the next few years when we have the next conference here, we will have more studies from our institute, from our country, so that we can do healing guided by your unique blueprint, personalized, precise, and powerful. Thank you, Sairam.
Thank you, ma'am, for throwing light on the precision medicine and the ways it can improve safety outcome. Moving on, we have three speakers, Mrs. Sherry Reinhardt, Emily Bruckel, and Dr. Preeta L. Mrs. Sherry Reinhardt is a registered nurse, cardiology at University of Rochester Medical Center, Rochester. Mrs. Emily